think you are all excited on what content we are going to discuss. Yes, before going to the topic, I would like to give a small scenario. For example, if a client is having high temperature and we need to reduce the temperature, what sort of procedure can be applied? Anyone from the group? If a client is having high fever, what nursing procedure we can do? Anyone from the group can tell the answer? Yes, why yes? What we can do if there is temperature? No, we can't go for hot, already temperature is low. What application we can do? Cold application. Yes. So today we are going to focus on what the procedure. Before we are going to discuss about the procedure, we are going to see how the physiology works on hot and cold application. Who are the persons indicated for our application, cold application? What are the principles to be involved and other things to be focusing in this video. So starting on with our 2025 batch days nursing students, we have Soumitra to start today by explaining on the hot and cold application introduction. Over to you, Soumitra.
Now we are going to see about hot application. Hot application is the application of a hot agent warmer than steam either in moist or dry form under the surface of the burn.
Well said, Soumitra. So here application is something you are going to apply on the patient's skin. So here this is, they are giving you a clue that is hot application. So we are going to apply something which is very hot on the skin, which is might be tolerable to the patient, not intolerable. Because if you are going to apply intolerable heat to the patient may have burns or scalds on the skin. So as we the nurses are there, we are going to apply the warmth to the patient's skin. Might be in the form of moist heat, which is having the wetness or dampness, and dryness, dry heat on the surface of the body. Next, over to you, Chair.
Now we are going to see about the purpose and the consequence. The first one is to relieve pain and temperature. The second one is to provide warmth, and the third one is to promote healing, and the fourth one is to decrease muscle tone, and the final one is to soften the exudates.
Yes, well said. Thank you, Ajay. So here the major purpose. Before we start the procedure, we have to know why we are doing so. For which purpose we are doing it. What is the action it is going to do on the patient's skin. So first and foremost they are given to relieve the pain. Pain means the patient is having an unpleasant stimuli. Unpleasant, intolerable stimuli which is being exhibited either verbally or non-verbally. So when you apply this dry heat or moist heat on the skin is going to reduce the inflammation, whereby the pain is also subsiding. And congestion. Congestion is where there is large amount of blood supply on the particular area. Maybe you have a recent fall injury. Immediately when you fall down on the ground, if there is no bleeding externally, but there is bleeding beneath the skin, where you can see the skin area being bluish in color or blackish in color. So that form of change in the skin we call it as congestion. So even that we can also reduce. And to provide warmth, already from the clue we know, hot application is something which is going to produce heat. So patient is going to get good warmth. Maybe patient is in the cold state or either when you apply hot water bath, they may be coming to near normal. Then to promote healing. So at the injured site, if there is no open injury, keep in mind, in open injury we cannot put the hot application. So if there is no open injury, to promote the healing process, we can apply the hot water bag or hot any form of hot application. Then to decrease the muscle tone. Whenever there is a strenuous exercise or when the people are working hardly, what happens, all the muscles will go for tightening. So when this tightening is happening, the muscle tone is actually increasing further and further, which causes the pain receptors to increase more. So in order to reduce the pain receptors, we can apply the hot water bath and we will relax the muscle, thereby the pain is reduced. Soften the exudates. If there is any patient having pus collection beneath the skin or maybe beneath the wound area, to soften those regions, we can apply the hot water application. Next, over to Rika.
For the next topic, let's move on to the classification of hot application, which is in turn divided into local and general, which again is divided as dry heat and moist heat. under dry heat lenses of international, hot water bottles, chemical heating bottles, infrared rays, ultraviolet rays, short wave diaphragm, heating lamps, electric candles, electric heating fans. And again, for moist heat, let's see few examples too. Warm soaps, hot fermentations, poultices, stews, paraffin pans, sitz bath, aquathermia pan. And again, until gentle heat, the dry heat, sun bath, electric candles, blanket bed. And for moist heat, we have steam bath, hot bath, whirlpool bath.
Thank you so much. That was a good explanation on what are the major forms of heat and how what are the common examples of what are the common forms of heat we can give, whether it is in the local application or general application. The local application means where you are going to particular to one particular site. Patient is having some sudden fall, there is some swelling in the upper extremity or on the knee or on the foot. So that area alone, if you are going to apply the hot water bath or maybe electrical baths, ultraviolet rays, that we call it as local application. General application means maybe patients having severe shivering. So patients having the whole body being shivered. So you are going to apply generally. Maybe patient needs a sunburn because of the full shivering. To reduce the patient's shivering control or to control the shivering signals, we are directly exposing the patient overall the body, not only one particular part. So applying to one specific part, we call it as local application. Applying all over the body, we call it as general application. So under that also it is further classified into dry and moist heat, as well said by Deepa. Thank you so much, Deepa. Next we can move on to the cold application.
Next we can move cold application. Cold application is the application of the cold agent cooler than skin either in a moist or dry on the surface of the skin.
So it is the same like how we saw in the hot application. In hot application, the only term was changed, that is hot agent. So here we are going to apply cooler agent, cooler than the normal temperatures. So here also we are going to apply two forms. One is moist and dry. As we saw in hot application, local application of cold is the general application of cold is also we are going to express. Thank you so much. Next we can see on to the purposes. So why the
Purpose of the cold application.
can you please move on to this side?
Next we move on to the purpose of the cold application. The first one is to reduce pain and body temperature, and the next one is to control hemorrhage. Next one is to control the growth of bacteria, and the next one is to prevent gangrene. Next one is to prevent edema, and next one, the last one is to reduce inflammation.
Well said, Anu. So here what we do is that the main purposes, as we saw in hot application, in cold application also, we are applying the agents first and foremost to reduce pain. You may have now a small doubt among yourself. Now what ma'am, cold also you are saying to reduce pain, hot also you are saying to reduce pain. But cold will have its own effect, which we will be seeing in the later slides, as well as hot will have its own effect on the blood vessel. We will see later in the physiology. And it is also going to reduce the body temperature. If the patient is having hypothyroxia more than 104, then we have to apply cold applications. Then to control hemorrhage. So here how we are going to control hemorrhage by just applying cold application. So this will be having the direct effect on the blood vessel, that is vasoconstriction. So when the vasoconstriction means the blood vessels are going for narrowing. So when the narrowing of the blood vessel is taking place, naturally the blood supply is also now controlled to that particular site, to the peripheral site or distal site. By the bleeding is being controlled. Hemorrhage, you all know it is a massive bleeding which is more than 500 mm. Then to control the growth of bacteria. So we all know that the bacteria will grow in a moist as well as warm temperature when compared to a cold temperature. But there are certain bacteria who are still viable even in the cold temperatures, but they are not virulent, they are dormant. They will be there in the atmosphere, but they are very dormant. That is, they are one among us, but not creating disease. So when you apply this cold application, it is going to control the growth of bacteria. Might be the size of bacteria might be reduced, or the multiplication of the bacteria can be controlled. Then to prevent gangrene. So gangrene is something which is dead tissue formation and necrosis may occur. So in order to, if you apply this cold application due to the vasoconstriction effect, there is less blood supply to the So intracellular and extracellular fluids will come get collected onto the peripheral cell. When you apply the cold application, it is also going to prevent the edema. Accumulation of fluid in the tissues can be controlled. The last and foremost is to reduce the inflammation. Inflammation is nothing but where the tissues are going for swelling. All these can be reduced. So next we have Divakar to explain on the classification of cold applications.
Okay, next we can see about the classification of cold application. And it is primarily divided into local and general. And we see about the local has two forms. The first one is dry cold and the next is moist cold. First we see some examples from the dry cold. There are ice packs, ice cola, ice pack, ice cradle, chemical cold packs. And next we see the moist cold examples. Ice tussle, cold compress, evaporating lotion. And the next form is general, and it also has a dry cold and moist cold. Dry cold has a hypothermia, and the moist cold examples are cold, spongy, cold bath, and cold bath.
So here hypothermia is nothing but hypothermia blankets will be provided. How patient is there in rival we are giving warm blankets. If the patient is having high temperatures, we can give hypothermia blankets. These blankets will create an atmosphere inside the patient's body or externally, or subnormal temperature where high temperatures can be easily reduced. These are mostly commonly used at freezing temperature areas like Switzerland or maybe Canada, North Canada, then Greenland, Finland. Those regions they will be using the hypothermia blankets. Very rarely used in India. So next, I am here myself to explain on the classification of temperatures. So in case of how we are going to use it. So the normal temperature what we use in our body surfaces for like we taking a bath in daily activities might be from 80 to 92 degrees Fahrenheit. So if you want to move on to the cool temperatures, we are going to lesser degrees, that is the way to 55, 65 degrees. And if we are going to very warm temperatures, it is going to 90 to 98 and 104 degree temperatures. So this is a small base of what we will be knowing of how extreme warm cold can be applied in the form of nursing applications. Like ice bath is very cold, it is below 15 degrees centigrade. And when you take very hot, it is above 46 degrees centigrade. Hot water bath which we do for all the common. So next we have Amit to explain on the topic.
These are the hot and cold combinations. Ice bath, hot and cold bath, hot water bath.
As Amit said, it is ice bath what we are going to apply in cold applications. Hot water bath or cold bath, you can apply for both purposes. You can utilize when you put this hot bath into warm water, it is taking its own temperature. If you put it into the freezer, the gel is going to take its own freezing temperatures. And hot water bath, as usual, how we are going to apply to the patient.
Next one, we are going to see about transfer of energy. First one is conduction. Next one, convection, movement. Third one, evaporation, flow liquid gas transfer. Fourth one, radiation, electromagnetic waves. And fifth one, conversion, transfer from one energy type to another.
Yeah, thank you so much. So here in this how you can see an example of they needed against the electrical coil. Again, the water is going under certain processes and it is being warmed or heated. What happens conduction? So through the heat being transferred from the vessel to the handle. So that process from here, the heat is being generated even to the vessel handle and it is being heated. Where it is transferring from one object to another object. So that we call it as convection. Then you have the convection where water is getting boiled up and it is getting certain bubbles, movements. It is also going to take place with direct contact. Evaporation, what happens? So when you put a lid over here, the water will go in the form of vapor and it is in the form of droplets or bubbles. And finally radiation. So radiation, you can feel the warmth not only on the saucepan as well as on the area where the grill is being placed. Even close to adjacent proximity where the temperature being sensed. And the last one is conversion, that is from one point to another, energy is transferred. So these are the major physiological effects which I wanted to explain. So vasoconstriction means the blood vessels are narrowed. Peripheral means on to the distal side, that is your hands and lower extremities. Whereas in hot application, peripheral vasodilatation. Dilatation means blood vessels are opening wide enough. So in case of vasoconstriction, blood vessels are narrowed, so blood won't be perfused to the distal extremity. So you can see there is decreased capillary permeability. Capillary are minute blood vessels. These minute blood vessels are now getting decreased. So when you touch the patient's skin, they will be having chill extremities. Whereas in case of hot application, due to the opening up of the blood vessel, there will be what? Increased capillary permeability. And in the next one, they have given here decreased oxygen consumption, because already blood is not being going or passing through the capillary. So oxygen is not being transferred. So there is very less O2 being consumed in nucleus of the tissue. Whereas in hot application, due to the vasodilatation, the tissues in the peripheral sides are having increased oxygen being utilized. Then you have decreased local metabolism, that is the blood vessel to the distal side or the peripheral side is now narrowed, so there is no blood exchange in the capillaries. So you can see metabolism is very minimum. Whereas it is opposite, because of the vasodilatation, more and more blood is being perfused into the tissue, whereas increased local metabolism. So when you take the blood viscosity, that is the thickness of the blood in due to the vasoconstriction effect, the cold application, the viscosity, that is the thickness of the blood is high, whereas the viscosity of blood here it is low. Because there is vasodilation, blood is very slowly perfused. In the cold application, you can see there is decreased blood flow to the particular site wherever you apply. Whereas in hot application, due to the vasodilation effects, there is increased blood flow. So when the blood flow is reduced, naturally the lymph flow is also reduced. On the other hand, when the blood flow is high, the lymph flow, lymphatic system flow is also high. The last is that there is motility, that is movement of the leukocytes, WBC is very much reduced. Why? Because blood itself is not perfusing to the capillaries. But whereas in hot application, there is increased motility of leukocytes. So I think so far you are clear of what is the hot and cold application and what is a normal physiology. So we will be seeing the other details, that is what are the modes and how it can be done, pre-procedure, during procedure and after procedure in the other video. Thank you so much for your patience. Do you have any queries, any doubts from the group? Can anyone say what is vasodilatation? Yes, Fatima, can you try what is vasodilatation? The blood vessel, how it is going? It's going to narrow or it is going to widen? Widen. Blood vessel will widen up, so that we call it as vasodilatation. Can anyone from the group explain what is vasoconstriction? Eva, can you say what is vasoconstriction? Okay. So we can clap for both of them. We will close the session of this. What is the introductory part on hot and cold application. Thank you.